Welcome to Nicaragua. We're breaking down Practice Bulletin 105. The summary of recommendations include that after bariatric surgery, there's an urgency to discuss contraceptive counseling as well as failures of OCPs. Additionally, bariatric surgery is not a recommendation for a cesarean section and should not be indicated to improve fertility. The first part of the Practice Bulletin just breaks down obesity in general and all of the associated increased comorbidities with it, including congenital anomalies as well as a risk for stillbirth. The focus of the bulletin, though, is on bariatric surgery, which can be recommended for patients over a BMI of 40 or those over 35 with additional comorbidities. The common procedures are either going to be restrictive or malabsorptive, with roux-en-y bypass being a combination of both. There's three important things to at least remember after a roux-en-y bypass. The first one is that pregnancy rates can double from at least 6 to over 12%. The second one is that you should be waiting at least 12 to 24 months afterwards so the fetus is not exposed to extreme weight loss. And the third one is it's common to have deficiencies in such like protein, calcium, B12, folate, or vitamin D. You can try orals for this first, but you need to check levels to make sure that the mom is actually getting increased levels that they're supposed to. And the last thing is that some patients might not tolerate the 50-gram glucose tolerance test. And the proposed alternative in the Practice Bulletin is that these patients can do a fasting home glucose as well as 1-2 hours postprandial. And that's the overall breakdown of Practice Bulletin 105. The more you know.